Hi everyone, and welcome to Altitude's presentation that we are calling Chair to Trail, and it is a discussion on how to run safely when you are a desk jockey. This is the voice of Lisa Corken, physical therapist at Altitude's Boulder location, and we are also accompanied by...
This is Aaron Knighton, also a physical therapist at Altitude's Boulder location.
So what we want to disclose here is that we have no financial interest with this presentation. Any products or anything we really discuss are just examples. It's not meant to serve as comprehensive physical therapy evaluation or diagnosis. If you feel like you would be someone who would benefit from a running analysis or posture analysis or anything that we discuss in this presentation, please feel free to call us or contact us. So who are we and what do we do? So as physical therapists, we are considered experts in human movement and performance. That is what our training is on. We do extensive anatomy work. Some of us 3 years, some of us TA'd in undergrad. I personally have about 5 years of doing anatomy work. So we know the body very, very, very well, and we know how it moves really well. So we learn to observe and diagnose movement impairments that can lead to injury, and we find pieces that don't work to help you rewrite it to be more efficient. So we'll watch you squat, we'll watch you single leg squat, we'll watch you bend forward, touch your toes, and in this particular case, we'll probably watch you run. So physical therapy really encompasses injury recovery, injury prevention, and enhancing your movement. The anatomy. So we really are going to focus on anatomy from what I usually say is the waist down. So when you come into physical therapy for an evaluation for running, a lot of times we will look at you basically from your lumbar spine all the way down to your foot and ankle. So the lumbar spine is what we consider your low back. Most of the movement is flexion and extension, so bending forward and touching your toes or reaching up to the sky and leaning backward, but it also does provide some rotation and side bending. The pelvis is the point at which your lumbar spine and your hips meet. And then the hip is that big ball and socket joint that can move in every direction. We call it 3 degrees of freedom. We also have the knee joint, which you'll notice is skipped because we went straight from lumbar, pelvis, and hip down to the ankle and foot. Later in the discussion, we talk about how the knee is really the unfortunate joint between the ankle and foot. The knee really only moves in a bending and straightening motion, has slight rotational components that can be important, but for the most part, any kind of knee injuries you develop during running are likely an issue from the foot or the hip. So we move down to the ankle and foot complex next. The ankle and foot is an incredibly complex part of the human body. It has 3 planes of motion that work together diagonally. It's supported by muscle, tendon, and ligament structures. Tendons, just so everyone can have a little bit of anatomy review, attaches muscle to bone, and ligaments attach bone to bone. The arches themselves are supported by active muscle tissue and passive muscle tissue. So we'll talk a little bit more about pronation, supination, because that is often what people will come in and tell us what's wrong with them. So we always talk about, the pronated foot or the flat foot versus the supinated foot or high arches. What we always tell our patients is that neither is bad. And in fact, pronation is required for shock absorption in the foot. So when someone tells us that they're a pronated runner or that they've been told that, a lot of times we'll tell them that that's okay, ultimately if it is controlled. So supination is needed to be efficient when pushing off, but when we can control both pronation and supination, no matter really how much range of it you have, it's okay. Again, as long as we have that support and muscle control. Here are some range of motion requirements for running that I've kind of talked about. The pelvis will drop 5 degrees either way, and I'm going to put my hand in front here just so you can see. So when we talk about the pelvis dropping 5 to 7 degrees, we kind of mean it rocking side to side. So when you're looking at a runner from the back. The hip has 40 degrees of flexion and full extension. So usually the hip and pelvis combine together to create this relative rotation motion for each individual runner. The knee will flex at 95 degrees of flexion for swing. The ankle will have full plantar flexion, which means going up on your toes to push off, and will have 50 degrees of dorsiflexion on the ground. The toe actually is an incredibly important joint and often a big factor in terms of Achilles tendonitis or plantar fasciitis, because it actually needs 90 degrees of extension range of motion, which means when you stand up on your toes, that big toe joint needs to be able to effectively bend at a 90-degree angle. When we talk about running in the clinic or as a profession, ultimately what it really is controlled falling. We are inverted pendulums, meaning we're just constantly in a state of falling even when we're standing or walking. But with running, we're adding so many different variables in terms of speed, or the frequency of our steps, our cadence, etc., etc. And so we need to be able to make sure that we're running and balanced enough so that we don't fall over. So this graph just kind of shows the different forces of the ground reaction force, the aerodynamic drag force, and the force of gravity. And our body needs to be able to control all of that so that we don't tip over and that we continue to propel forward. So muscles and movements along the entire body are working together for efficient running. So your upper body can impact the lower body and vice versa. So basically, if your upper body doesn't move and you can't rotate through your thoracic spine, what's going to happen is that movement is going to be placed somewhere else. And this is where compensations and injuries can occur. This last section talks about how each portion will build on the last, which ultimately is what I just said, is that if one portion doesn't function properly, other parts of the chain will suffer. And the area of injury most of the time is not the cause, like I mentioned specifically in the knee, but that can happen in other places as well. And now Aaron is going to take over.
So many people are sitting down for a majority of their time, sitting at a desk working on a computer. So one of the big questions that we often get is, does my posture have anything to do with this? The reality is posture itself is not a bad thing. It's more so about how long you stay in a particular posture. If you're sitting all day long, the likelihood of tight muscles occurring in the front of your hips and your ankles is going to go up, but then also if you're standing too long, your body's going to get fatigued. So it's more so about being able to transition between these postures. So take that time to transition between both sitting and standing. So in sitting, something that can happen, we have a forward head posture. So what happens is there's a restriction in weakness in the front neck muscles and a weakness behind the shoulder blades. How this impacts your performance as a runner is it can limit the breathing in your arm swing, which is required for your balance. Also, restriction in the upper and lower back can occur, which once again limits your ability to breathe efficiently because it limits your ability to rotate. It will limit that arm swing, and then also can limit the pelvic rotation, which translates down to the leg and foot, which Lisa talked about earlier. As I mentioned earlier, sitting can tighten up the front of your hips, which are those hip flexors that Lisa mentioned. What this does is it limits your hip extension. What can happen is you can have excessive low back and pelvic rotation and retraction. But what it also does is restricts the activation of your glute muscles. So you start to compensate with other leg muscles. The final piece with the hip flexors that we often forget is when your leg does come behind you when you're running, there's a reflex that occurs that automatically draws that leg forward. And if we're too tight, we can't take advantage of that reflex. As we work the way down the leg, if we have tightness in the hamstrings, those big muscles that are behind the leg, they can become short, and you might see a little bit of a shorten in your stride, which can lead to more low back and pelvic motion, but it also limits muscle firing. And then finally, with tight ankles, this can also shorten your stride and limits the power of your calf muscles to propel you forward. So what really is muscle imbalance? Does it actually equate to physical weakness? And the answer is not necessarily. Imbalance is more focused on using the wrong muscles at the wrong time, really not knowing how to utilize the strength that you actually have. So why does this occur? in our bodies, we have things called primary and secondary movers. Primary movers are muscles that are intended to move the body in that one direction. Secondary movers are muscles that do a variety of different motions and don't actually have a primary action. So when a muscle is working double duty, it can't work efficiently, and so that muscle then fatigues. And this can go into range of motion restrictions, which can also lead to more muscle imbalance. A common question is, can you actually stretch your IT band? The answer is no. We've actually done research on this, and in order to stretch the IT band 1% of its length, you need to apply a force of 2,000 pounds or greater. I don't know about you, but I would not be able to tolerate that amount of force on my IT band. And so what we do in order to work with the IT band is we have to intervene at the muscles that attach to that band and to help get strength and mobility so that the band itself doesn't pull on the leg. So does mobility really fix everything? We often get a lot of individuals that say, I stretch this and I stretch that, and yet I still have pain. It does help, but it's only one component of the whole system. So when we're talking about stretching, one of the things that we know is you don't necessarily see a huge benefit after stretching for 30 seconds, but it's more about how frequent you do it than how long you do it. So in your day, if you're able to transition those postures and get up and out of a seated position and stretch, that's going to be the best thing to occur. So what we also look at is stretching is also more so impacting the tolerance of your nervous system to accept a load than actual lengthening of the muscle itself.
So one of the things that I would like to interject here is, as Aaron mentioned in the slide before, about how important hamstring flexibility is, and it is important to help with stride. You know, it's not important that you can touch your nose to your knee. You know, I always tell my patients hamstring stretching is important, but if you have enough hamstring flexibility to run, your hamstring stretching may not be our main source for your rehabilitation. I always tell patients, like, you need to have really awesome hamstring length and strength to be a hurdler. I mean, those people literally almost touch their knees to their nose while they're doing the activity that they like to do. So that's kind of the idea of this mobility versus strength and the importance of our role in identifying where your limitations and need for improvement really is.
So as Lisa alluded to, it's not just the fact that we need to stretch the muscle, but we need to strengthen the muscle as well. Often if we're just stretching the muscle, we're actually training that muscle into a length that it has no idea how to control. So muscles have memory. They only know how to function in the range that they've been trained. So if a muscle is only stretched and it's too long, but you haven't strengthened that muscle into that new range, that mobility is uncontrolled, and that's actually what can lead to a lot of muscle strains where you hear of people pulling a hamstring or pulling a hip flexor. So what we need to do is both look at strength and function. So now that we've actually strengthened it, what's the task at hand? So can we now do a strengthening exercise that mimics the activity we want to do, mimics running, so that the body is more aware and the muscles are more aware of how to accept this load, and this is done through both static and dynamic strengthening exercises. So we're going to move into some common running injuries. The first is we're going to talk about the hip. I just mentioned that there are potentials for muscle strain in the hip flexors, the adductors, and the hamstrings. So a muscle strain usually occurs due to an imbalance on which muscle is actually dominating a movement. So if one muscle is taking the role of two motions or a greater percentage of that activity, an injury occurs. So what that means is when we talk about compensations, one muscle is just working way too hard. The other piece that happens commonly with runners is what you hear of hip impingement. You may visit an MD and all of a sudden you are diagnosed with something called an FAI or hip impingement, and it can sometimes seem like the end of the world. It really is not. We can treat that very well with physical therapy. But what it is actual physical changes that do occur from development and repetitive motions in the hip joint itself. These can be bony changes, but what we actually do know it's a big muscle imbalance that is causing this, and we can help correct that. So a couple ideas for some exercises for the hip. One is to stretch the hip flexors. The first picture that you see there is one that we often give people and we often see people doing. A common misconception with this exercise is I'm going to lunge forward as far as I possibly can. What we want to make sure that we're not doing is just moving through the low back, but also allowing the hip itself to move. It's very easy to feel like you're getting a stretch through this, but the low back is the only piece that's actually moving.
One of my tips usually for this particular exercise is to have the patient engage their glute muscle while they do it. That is sort of the imbalance that we're talking about with these hip injuries and hip impingement, is when that glute doesn't fire in the extended position of the hip. That muscle imbalance puts more strain on the hip flexor because it's not getting that opposite or contralateral, antagonist support that it really needs. And this is a really important part of that stride with running when you're trying to get that leg behind you.
A great exercise to complement what Lisa was just talking about is the picture that you see on the right. A lot of people call this the runner's lunge. Sometimes we'll use this as a slide lunge where the back leg is actually sliding backwards and down, and then you come into a knee drive position and a little bit of a hop at the top of the range. We're trying to make this a little bit more dynamic so that the trailing leg can actually get into some hip extension with that glute firing, but then you also get that propulsion from the stance leg. So traveling on down into the knee, we're finally reaching the knee. Areas that are commonly injured or have pain is the patellofemoral joint. And so you might have heard of runner's knee. It hurts right here and someone points to the very front of their knee. That's that patellofemoral pain that you can get. There are multiple causes that can lead to this pain, both from range of motion deficits but also from strength. One of the places that we most commonly see is particularly with the ankle. So if you don't have that 50 degrees of ankle dorsiflexion that we talked about before, or the 90 degrees of that great toe extension, we're going to start to bend that knee really, really quickly in the stride and put a lot of strain through the front of that knee. So you can check this by putting your toes up to the wall, keeping your heel down, and trying to bend your knee to touch the wall, and then trying to move your foot away from the wall as far as you can. I typically do about a hand width away from the wall for my toes. The other piece is just looking at the big toe. Can your big toe actually move that 90 degrees that's necessary? The other place that we see injuries occur often in the knee is that IT band. As we mentioned, we can't actually stretch it, and so we have to look at multiple variables as to what muscle imbalances and range of motion deficits are causing this. Could it be tightness up in the hip at the TFL, which is the primary muscle that it attaches to? Could it be fascial restrictions coming down the leg that can also be pulling, or even just motor control of glutes not firing well? So a couple ideas for knee injuries.
Hey everyone, that's me, by the way. That's Lisa.
Lisa was our model. The two of our favorite exercises, the one on the left, the side plank leg swing. Basically what we've done here is we've taken running and turned it on its side. If you notice, the leg that is on the ground is mimicking the stance leg, and so you're lifting that hip up, so the knee, the hip, and the shoulder are all in alignment, and the hips are being pressed forward, so those glutes are engaged. While you're in this posture, that top leg is slowly swinging back and forth without your hips dropping backwards or your back excessively arching. This is one of the best ways we can start to mimic running in a task-specific exercise. The next exercise that you see Lisa doing, we use this for that controlled pronation that we were talking about. Uncontrolled pronation can lead to knee collapse and knee pain. So if you hold a band and you stand on one foot, you're going to rotate over that foot and try to form an arch, and then slowly rotate that back. What we're trying to mimic here is that loading response of the running gait cycle, so that posterior tibialis muscle can actually control the arch.
So Aaron and I actually had a really interesting case about 2 years ago. This runner came to us. She had complaints of IT band pain for 10 years. And the first thing that Aaron and I did is we put her on the treadmill and watched her run. And surprisingly, her response was, no one in 10 years has watched me run, which we couldn't believe. But we had never seen anything like the way she was running. She landed pronated, stayed pronated, and took off pronated. And as we mentioned before, how important it is for you to be able to supinate and pronate as long as it's controlled. She couldn't supinate or control supination at all, I should say. She had supination range of motion and the ability to supinate. She just wasn't doing it while she ran. Her glutes were super strong, which is a huge place for knee injury. So we knew that that wasn't necessarily the area that she needed to improve. We gave her this posterior tibialis rotation exercise, and she worked on it for probably 2 to 4 weeks. And she came back and saw us and was pain-free running and didn't need orthotics, and it was incredible.
Awesome. Okay, so we're going to translate now down to injuries at the foot and the ankle. It's often that we see Achilles tendon injuries or Achilles tendonitis. What this can be due to is a range of motion impairment or also a muscle firing somewhere along the chain. Once again, we're coming down to that big toe. If that big toe doesn't want to extend well, you're not going to have the appropriate range of motion, and the calf muscle and the Achilles tendon is going to just take too much of a load. The other piece is hip extension, which can limit some of that posterior muscle chain firing, so those glutes, those hamstrings, and put even more strain onto the ankle and the Achilles tendon. So if we can get those range of motions worked out and get the muscles firing better, we can reduce the strain that comes through that calf and Achilles. The other is what we were just talking about, the posterior tibialis tendon. Why is this important? As we've kind of hammered home, it's the primary supporter of the active supporter in the arch of the foot. And so that muscle has to be able to control that arch when you load in a run. And so if you don't have strong control, you will have uncontrolled pronation, and which is what Lisa was talking about with this one client, where she developed actually knee pain because of it. So these injuries then can lead to stress on the arch, and what we often see is that arch collapse. So once again, a couple easy and simple ideas for the foot. If you want to improve that range of motion in your ankle, take a very tight band, sometimes it won't even be elastic, and put it around the base of the ankle pulling backwards. You can slowly lunge your knee forward over that second or third toe and keep that heel down. You'll start to see that ankle motion start to improve. The other part is working on improving the little tiny muscles that are in the foot itself. So an exercise I like to do is strapping a band around your foot and over your toes, curling your toes against that band and holding that curl while you slowly start to point the toes down. Keep those toes curled while the foot comes back up, and then uncurl the toes. If you start to feel a cramp in the arch, that's okay. It just means we got to get those muscles a little bit stronger.
It's incredible how many patients actually struggle with these exercises in the beginning, but also remember that the human body really is incredible at learning, and so oftentimes we only have to give patients these exercises for 1 or 2 weeks, and then we can really up them to higher level, more functional return to exercise activities, just because we've been able to turn these muscles on.
So the big takeaways of this presentation is running is a very accessible, but it's also a very complex sport. And so when movements aren't efficient or controlled, injuries can occur. The one big thing that we always talk with our athletes about is just running is not enough to make you a better runner. You have to work on key points of mobility and key points of strengthening, and intentionally perform those pieces prior to your run as a warm-up, or even you can use that as a cool down. But just running isn't going to make you stronger.
I often like to interject here and talk about how while we say that just running is not going to make you a better runner, that doesn't mean that your warm-up should be doing a mile hike either. We really are specific on needing this, very unique strength training, unique mobility training to what your body needs specifically. It can't just be, well, I swam yesterday, so I'm going to run today, and I'm going to climb tomorrow, and those types of activities are not the cross training necessary to support the activity that you're really trying to achieve. So ultimately, Our biggest thing is to have fun, be safe, and train wisely. You can come to Altitude if you feel like you want a running analysis. We all do it here. We take video of you, we slow it down, we put angles on it if we need to, we explain to you what's going on. What's more exciting is that we've all been doing it for so long that, just doing a movement screen, we can probably tell how you're going to run, or even hearing the history of your injury, we can probably identify before we even watch you run what's going on. But I can assure you that we at Altitude will watch you run because that's a super important part of identifying where your strengths, weaknesses are, and where your room for improvement should be. So normally we would ask if you had any questions, but since this is our webinar, at this time we're just going to go ahead and end the presentation. If you do have questions or you want to talk to any of us further about this, please feel free to make an appointment at altitudephysicaltherapy.com. Again, this is Lisa Corken from the Boulder Clinic.
And Aaron Knighton, also from the Boulder Clinic.
Thank you so much for listening.